Hi everyone, I'm Dr. Faisel Syed,
And I'm Dr. Dan McCarter.
and you're listening to Faisel Friends, where we believe access to primary care is a right, not a privilege. Today, we're talking to Larry Bauer, former CEO of the Family Medicine Education Consortium, the FMEC, about innovation in family medicine. Let's dive right in. Hello there, welcome. It's good to see you.
Hey, Larry, good to see you.
It's good to be seen.
Thank you for joining us on this podcast today. We have so much to talk about. I'd like to talk about Larry Bauer, the man. Larry Bauer, the person that we met at FMEC, your path to getting to FMEC, and the work that you're doing at this current time now that you've left FMEC.
Where would you like me to start?
Well, how did you end up getting into so passionate about family medicine education?
In 1978, I stumbled into a job at the Department of Family and Community Medicine at Penn State Hershey Medical Center in Hershey, Pennsylvania. And I'm a social worker by training who had a very special interest in how people teach and how people learn. And I learned about this new position. It was the director of faculty development at that department. And there were very few people back in that stage, very few people who were professionally trained for, working with doctors, teaching them how to teach. So I had the great fortune of being hired. And then I had to learn about doctoring. If you're going to teach physicians how to teach, and I started off with family docs, but then as the word about me within the medical center grew, I was the only person like me in the medical center at that time. And I got to work with surgeons and OBGYNs and pediatricians and a whole the whole spectrum of specialties. But starting within family medicine, it was so I was very fortunate that the department chair, Tom Lehman, who took me under his wing, and the chief resident, Pat Jonas, both took me under their wings and said, look, wherever we go, you go. And so whether there was a code or there was a home visit or there was a surgery or whatever it was, they just grabbed me and said, you got to see what we're doing here.
You're completely immersed within.
Exactly right. So I tell people I went native. I knew nothing about doctoring. I had my own, growing up in a working class community in Buffalo. I had some biases about physicians that weren't based on anything other than, cultural thoughts about doctors. And so what I learned about family physicians is their really rich philosophy of care. And after a while, I began to, as I saw the research that was coming out about their impact on health, I appreciated that the nation needs more family physicians, and whatever I could do to help the docs who were being trained at the time, to help the faculty to be more effective. And after a while, I got involved in efforts to increase the number of students choosing family medicine. So I became a family medicine believer because their philosophy of care resonated so well with my approach to healing, to helping. I had done work as a family therapist, and I had done community organizing work, and I had actually worked in prisons as well prior to starting in medicine. But their approach was so rich. And when I looked within the house of medicine, it's not that there weren't other good people and other specialties. I got to know a lot of physicians across all the specialties, and there were a lot of very, very good people. But as groups go, family docs are more patient-centered, relationship-centered. And I think their contribution to healthcare delivery and to the health of the population is such that, to put my career in the service of that good work is a career well spent.
I'd like to talk a little bit more about your feelings about family doctors or doctors in general when you were growing up, because I have my own mother doesn't trust doctors. She had a perception of physicians for her own reasons. And then it wasn't until I became a family medicine resident that she saw this relationship based style of practicing medicine, where the doctor becomes intimately connected with the patient's friends and family, and the doctor becomes a member of the household. So what was it that was that aha? Did you have a similar aha feeling when you were exposed to family medicine? Did that happen?
When I spent time going on rounds, or I spent time sitting in the precepting room when the residents would come in and present their patients to the attending physician, and I would hear how they thought, and I would hear how they struggled to build relationships and to build trust with people. That was really uh, what convinced me that uh, the work they were doing and their approach to work were so really important. I'm going back now into the early '80s when I was still fairly new in my work, and I would hear them tell stories. Now they would tell these stories to each other, you know, and I would say, "Oh my God, that's amazing what you just said about how, whatever that was that they did with the patient." And I said, "The world doesn't know what you do and how you do it, and the world needs to hear about this." And they would universally go, "Oh, it's no big deal. I don't like bragging. It's just what I do." And I say, "Yeah, exactly. And the world needs to know about that." So interestingly, at that time, that was in the post Marcus Welby era. So in 1970, 71, and 72, Marcus Welby, MD, was the most popular TV show in America. And on the three channels that we had back in those days. And these folks, both the men and the women, were the Marcus Welbys. In their humility, their not wanting to brag, was both a strength and a weakness, in my opinion. It was a strength because they didn't grandstand, they didn't lord it over patients, they didn't walk into a room, like the son or daughter of God. But it was also a weakness in the sense of too much professional humility. In especially in this era now where marketing is so important, family docs were reluctant to tell their stories, and so what happens is if you talk to people who are in their mid 50s and older, and you ask them about what they're looking for in healthcare, they will tell you, and they will use the words, "I want a Marcus Welby for my doctor." And when you talk to people under that age, like our oldest daughter, when I asked her one day, "Do you know who Marcus Welby is?" And she said to me, "Did he play baseball?" I knew that, she had no idea about what I was seeing every day. And I've been harping on family physicians to figure out ways to responsibly tell their stories so that policymakers and others can see what I see and appreciate the value.
Yeah, I heard somebody on a podcast this morning talking about um, it, y- you you don't do a randomized control trial of parachutes, right? You can't get anybody to sign up to be in the placebo group for that trial. We know it works. I mean, we've had evidence for decades that patients with a close relationship with a primary care physician gets better outcomes, but yet the CPT code, that all started about the time I started practicing, finishing medical school, and it's trying to break down that relationship into individual parts. It's the the Medicare wellness visit, or the chronic care management codes, or the new principal care management codes for people with one condition. And it truly is about sweeping up crumbs off the floor and asking the primary care doctors who are already overworked to spend time doing special documentation for these things, when they would have more time to do all of this very necessary care if we would just take the shackles off of them and let them do it. But we've got to come up with another payment system, right?